Americans spend billions of dollars every year on facelifts, fillers, and Botox. They do so to maintain youthful appearance, of course. But research now showing that receding hairlines and baldness are major physical signals that a person is aging or perhaps even sick.
Joining us now is plastic surgeon Dr. Richard Chaffoo of Newport Beach Hair. He is the co-author of a new book titled Hair Loss Solutions, the Ultimate Guide to Restoring Your Hairline. Good morning.
Good morning.
It's good to see you. So what are the main causes of hair loss?
So there are a number of causes, Jessica, for hair loss. Probably the most common one is something called androgenic alopecia, which is hormonal. But we can certainly see it in terms of people that are hereditary. We can see hair loss secondary to drugs, certain medications that patients may take, may be an additional cause. There may be illness, chronic illnesses, autoimmune diseases are all possible factors that can be associated with hair loss.
Isn't it your mother's father, right? Don't we commonly look to that?
So that was once thought to be the case, but it's actually on both sides of the family. It can be on the mom's side, but it can be on the father's side, or it can be sporadic. There may not be any familial relationship. So we're not sure exactly in all cases.
So you say to look for symptoms. Are there symptoms other than what's obvious?
Probably not necessarily, because 95% of hair loss is hereditary. However, in that 5 to 10% that isn't, you might begin to notice in certain autoimmune diseases, there may be some changes in the scalp itself. So you might see some scaling of the scalp. You might see a sudden shedding of hair. Some certain patterns of hair loss suggest an autoimmune process, where a circular pattern is called alopecia areata, where you actually can lose certain areas. This is a gentleman that actually had hair restoration to his beard line. He wanted to have more of a beard line, just could never grow a beard very well, and that's something we can do actually from scalp hair.
Really?
We not only make a mustache, a goatee, and a beard line, but in women, we can actually restore, replace the eyebrows, not only in people that just have plucked them extensively, or even people that have had traumatic injuries or burns. We can replace those. It can be really a significant change for
With
them.
the beard hair, can you go backwards? And the mustache and beard, take it and put it in your head?
So that's a great question. I mean, there's, people that talk about body hair, doing body, but the problem with that is...
Well, it's always the bald guy that has a hairy back.
Yeah.
Right?
Always.
You see that all the time.
And I have patients come in and say, well, how come you can't make
Switch it around.
Switch it. The reason that you can't is it's a different type of hair. The quality's not as good, the life cycle's not as long, and the density isn't as good. So, and plus the issue is scarring.
When you transfer hair from the head to the facial line, does it behave like a beard? Does it grow?
No, it grows just like scalp hair. So when you do take the hair, you actually have to take it as an individual hair follicle. So it's a very tedious process because, of course, hair on our scalp grows either as single hairs or as groups of hairs. But on the beard, the mustache, and the eyebrow, they're very single hairs, very fine hairs. So it's a real painstaking, tedious process, like building an Omega watch, essentially.
Okay, so you mentioned some of the reasons why we might have thinning hair, and then you also think that now men and women, there's male pattern baldness, and then there's just thinning of the hair, right?
There is, and so the difference between how a male and female pattern hair loss presents is typically in men, it's hair loss in the frontal area or in the crown or both, but in women it tends to be more of a diffuse loss along the part line. We get what's called a Christmas tree pattern, and so it's both those cases are thought to be hormonal oftentimes, but how they present may be slightly different. There are some women, though, who will lose their hair in more of a male pattern, but that's an unusual situation.
So someone hears these symptoms at home, they can relate to them. When's the time to go see a doctor like yourself?
Well, if you want to go see the doctor, unfortunately, by the time they come to see us, we've lost clinically half the hair on our head. So we're born with about 100 to 150,000 hair follicles at birth. You have to lose half of those before you notice clinical baldness. So by the time a patient comes in to see us, they've lost at least half the hair in that area. And that's the time, obviously, where we need to begin treatment. Medical treatment's great. They're great options surgically to restore the hairline.
Is there a way to look at a man and say, you're going to lose your hair? Can you look at my hair and say that?
Are you scared?
I'm asking for a friend.
You're asking
You've got great hair.
I think vanity-wise, for men, that would be the biggest ding
No question about that. 40% of men at the age of 40 have lost their hair. Each decade, you can add another 10% on top of that. So, but you're right. If you have no family history on either side, it's unlikely, but it can happen. And we see young men as early as their early 20s begin to lose their hair. Very stressful for them. They're very freaked out about that.
So these are some of the risk factors. You mentioned family history,
family history.
age. So if you're 40 years old and you've got a full head of hair, you're looking pretty good as you
pretty good. You're
Get
not
over
out of the woods.
Okay,
But, you know,
okay.
but women, it tends to occur a little bit later in life, Jessica.
Yeah.
So by the time you're, say, in your 70s, about 60% of women will actually notice hair loss, and part of that's hormonal in nature. But there are you know, medical problems. You want to rule out that they're, you know, they have diabetes or thyroid
Right.
disease.
But there are ways we can now fix it.
Yes.
See you.
Yeah, to make it look essentially. The thing people worry about is their hair loss is going to, you know, when they correct the hair loss, it's going to look very artificial.
Yeah.
Today, we can literally recreate the hairline the way it looked before they lost it, so
Wow.
it's imperceptible. They come out of the shower, they come out of a hot tub, their hair is slicked back. No one's going to know they've had hair restoration done.
Well, Selvig's Mark goes to a lot of hot tubs, so that'll
That's amazing. Doctor, thank you.
Thank you.
Thank you very
Dr.
much,
Richard
Doctor.
Chaffoo is a plastic surgeon at Newport Beach Hair, co-author of the book Hair Loss Solutions, The Ultimate Guide to Restoring Your Hairline. Thank you
Thank you.
very much.